and I've specialized in nutritional medicine in the last 25 years of medical practice, and have gotten tremendous satisfaction watching people reverse their diseases and targeting the nutritional approach to their particular problems to enable them to get well. And the results have been dramatic and remarkable. And I think it's appreciated how the body can get itself well again. I mean, people with asthmatics who can't breathe and are up in the middle of the night taking inhalers aren't told that they could make a complete recovery if they improve their nutrition sufficiently. And so it's not my motive to figure out what Americans would want to do or what the masses would prefer to do. It's giving people the opportunity to get well and advising and trying to devise the ideal protocol to maximize health and to maximize the body's tendency to repair and recover and get a complete recovery. And with doing that, so it really doesn't matter to me, or I'm not saying it doesn't matter, but it's not really my intention to convince the whole world what to do or to modify my recommendations to fit what would be popular. Popularity doesn't interest me at all. What interests me is that person with rheumatoid arthritis who wants to get well without drugs can get well. That person with ulcerative colitis or Crohn's disease has the ability to get their health back without being on drugs that can cause cancer. That person with diabetes who's 60 pounds overweight with a heart attack waiting to happen can get rid of their diabetes, melt away their heart disease, lose all their excess weight, and then be healthy for the rest of their life without needing blood pressure medications, without needing cholesterol-lowering drugs, and without needing diabetic medications. That a person with advanced heart disease who's already having chest pain doesn't need to have their chest cut open or need to have angioplasty or bypass surgery. They can remove the atherosclerosis nutritionally. They can get their health back. They can be active again. They can get rid of their chest pain, and they can remove the risk looming over their head that's putting them at increasing their chance of having a heart attack. And I could say to them, look, do you want to have a heart attack or not? You can go ahead with this risk hanging over your head, like carrying a live hand grenade in your pocket, ready to explode at any minute, or you could diffuse it. It's up to you. But if you really want to diffuse it, it takes an aggressive nutritional change. You can't just make moderate changes in your diet. And for people who want to get well, and they can do so. And I think that if people were informed about the dangers of the medications, that blood pressure medications increase risks of other diseases. For example, calcium channel blockers have been shown to increase risk of breast cancer. People aren't told that. That when you take drugs to lower blood pressure and your diastolic drops too low, it increases risk of developing an arrhythmia. That blood pressure medications increase risk of falling down and having a hip fracture. That statin drugs to lower cholesterol and dramatically increase risk of diabetes. They can cause muscle injury and damage even if it's not noticed. And over years of use, that muscle injury may impact the heart. That the diabetic medications can cause weight gain and push the pancreas to work harder and cause it to poop out faster. In other words, if people were told that these medications, you don't get them for free, you pay a price for using medications. And they work as a permission slip. They enable people to think because their numbers look better, they're okay, while the underlying pathology advances day after day. So in a sense, they give people a false sense of security that leads them to give them permission to keep eating the same diet that caused the problem to begin with. And the inevitable consequence is their disease gets worse and worse and worse. With the right information, more people would choose nutrition as the avenue of getting well and not drugs. With more informed consent, as people were fully informed about how to get rid of their food addictions, how to prefer to eat healthy foods, the power of nutritional excellence, and the dangers and risks of conventional medical care, including angioplasty and bypass surgery and stent placement. When they really are totally informed, most intelligent and informed people would choose to use nutrition, not conventional medical care. I don't consider this alternative medicine. I don't call this integrative medicine. This is where medicine should be.